If you think my doctor prescribed me these knockoff monochromatic Skittles to enjoy on a regular basis, you are wrong. These are my birth control pills, conveniently called a pill, and they do not taste like the rainbow. If your parents and or educators were prudish and often danced around the subject of sexual health, more specifically birth control, then let me educate you on the three of the most common types of birth control: the pill, the implant, and the IUD. Since I've been on these pills for about 2 years now, I have done a lot of research to figure out which one was right for me. Because we're in that day and age where we should not be ashamed. People have sex. A lot. And there's nothing wrong with it or talking about it as long as you're being safe. And if you want to avoid pregnancy, then these pills are right for you. And even if you're not doing it, you can still find these hormonal contraception very beneficial. Not only will I be naming the types of birth control, but how it is used, the hormones that it releases in the body, and the effects those hormones have on the body. Firstly, I want to talk to you about the most common type of hormonal contraception, which is the birth control pill. And it's just that. It's a pill chock full of hormones that you take every day in the same window of time for the maximum effectiveness, which is about 99%. Now, if you do not take the pills properly, such as if you forget a day or you take it too late compared to the last time you've taken the pill, then your risk of pregnancy goes up. In your typical 28-day pack, you have 3 weeks of hormone pills, and then on the fourth week, you have no hormone pills, which is when you would experience withdrawal bleeding. Now, the two main types of hormones that are used in birth control pills are synthetic estrogen and progestin. According to the Center for Young Women's Health, estrogen and progestin work together to prevent ovulation, where the egg is released from the ovary, and thickens the cervical mucus so that sperm cannot fertilize the egg in the uterus. Now, the mini pill, however, only uses progestin, which only thickens the cervical mucus. However, this is not the only effect that it has on the body. Um, Many people that use birth control can also experience an improvement in their acne. For those that do not have regular periods, can have a pseudo period when they get on birth control because it mimics the natural menstrual cycle, and it can even reduce the risk of ovarian and uterine cancer, which is great for those that have a family history of those types of cancers. Secondly, I want to talk about another type of hormonal contraception, which is called the implant. Now, the implant is, simply put, a matchstick-sized rod that's placed into your arm by your healthcare provider. It contains hormones that are released throughout the body for up to 3 years. Now, the hormone that the implant typically uses is a type of progestin. Now, what this does is, according to WebMD, it thins out the uterine walls, it prevents ovulation, and also thickens the cervical mucus to prevent pregnancy. Now, an infamous side effect is that it can also drastically change the menstrual pattern. For example, you may bleed more often, more frequently, or irregularly, or you may not even bleed at all. Aside from this notable side effect, it's over 99% effective in preventing pregnancy, and it also can reduce your risk of ovarian and uterine cancer. Lastly, I want to discuss another type of hormonal contraception, which is called the IUD, or intrauterine device. Now, IUDs are small, T-shaped devices that are inserted in the uterus. Like the implant, you cannot DIY this. Go to your healthcare provider to get this procedure done, and it stays within the body for 3 to 12 years depending on the hormones and brand. In hormonal IUDs like the Mirena, it uses the hormone progestin. However, there is a type of IUD called the Paragard that uses the metal copper to prevent pregnancy almost magically for good. Now, the way the IUDs work are different from both birth control pills and the implant. They change the way that the sperm moves so that they cannot fertilize an egg. It's pretty sketchy, but surprisingly, it's more effective than tubal ligation or getting your tubes tied. Imagine that. A tiny little T-shaped device that goes in the uterus is more effective than doing the loopity-loop with fallopian tubes. Now, because of this invasive procedure, it can be quite painful, which is why most doctors suggest that it's only given to people that have given birth. according to Planned Parenthood. Of course, these three aren't the only types of hormonal contraception, but they prove to be some of the most effective out there to keep the babies, pimples, and even cancer away. To reiterate, the pill is just that, a pill that you take every day to prevent pregnancy. The implant is embedded into your arm by your healthcare provider, and an IUD is a small T-shaped device that's inserted in the uterus by your healthcare provider. Knowing which types of birth control are out there is important because you can take responsibility for your body and your sexual health. If you do decide on taking birth control, regardless if you want to prevent pregnancy or minimize your dreaded pimples, talking to your healthcare provider about these options is a great start. And we should start discussing Skittle flavored birth control pills because it's about that time.